All right, so now we're going to take it the other way, right? So we looked at patients with higher risk features who were unlikely to benefit. So we don't want to over treat them, but it's also really important to avoid under treatment, right? To pick out the wolf in sheep's clothing, the assumed clinically low risk T1N0 patients, because those patients have a risk of late stage 4 recurrence that will limit their life. And so we need to figure out who these patients are and not just stop therapy at 5 years, because we could save a life. And in this study presented here, BCI was able to identify a quarter of patients, 1 in 4, is likely to benefit from extending endocrine therapy and at high risk of late distant recurrence who had clinical low risk features, so T1N0. So in this, for this patient, 57 years of age at diagnosis, node negative, 1.3 centimeter grade 2 tumor, so stage 1, estrogen receptor positive. She was also HER2 positive, Ki67, 25%. So she received chemotherapy and HER2-directed therapy, but that's not enough, right, for our patients who are both HER2 positive and estrogen receptor positive. So we spoke about endocrine therapy. She wanted to get the best endocrine therapy. So we chose anastrozole, aromatase inhibitor, over tamoxifen. She did have some osteopenia, so we prescribed bisphosphonates. She struggled with this, had arthralgias, and she works with her hands as a hairdresser. So that was something that was very bothersome to her throughout her treatment course. She's a very compliant patient, yet she will do what we recommend, but we definitely, wanted to get her off of therapy if possible. But unfortunately, these are the results. That yes, she was likely to benefit from extending endocrine therapy, that if she stopped at 5 years, her risk of developing metastases in years 5 to 10 would be 10%. But if she continued therapy for another 5 years, that number was reduced by 2/3 to about 3.5%. So she saw these results and very much wanted to continue therapy, despite the arthralgias, all of it. She wants to continue, is 100% completely on board.
Mm-hmm. And she wants to continue because while she was being treated and going through all this, she had 2 sisters that were diagnosed with breast cancer. And so, of course, we're rushing to make sure that we've done the appropriate genetic testing, and we did, and it's all negative. So I think when she saw these results, it wasn't quite so bad for her. Like, she definitely wanted to stop, but I think in some ways this gives her some extra reassurance, that she's doing everything that she can.
Right. And I just spoke with her the other day, and her sister is going to lap her. So her sister is going to be done endocrine therapy before she is.
Oh.
Yes.
Oh.
Which, that's life, right?
That's
we take the information.
Love.
Yes, exactly. Everybody's breast cancer journey is different.